So quickly looking at the next medical condition of the ovaries. Now this is what is known as the ovarian cyst. Can you see a normal ovaries? This is how it should be, very peaceful. But when you're having like a ball, okay, the ovaries is enlarging like a ball. That's what is called a cyst. Okay, ovarian cyst. Can you see this? All right, you can have cysts everywhere, but this one we're talking about the ones that can be found in the ovaries, to be specific. So it's just a fluid-filled sac, it develops on or inside the ovary. You understand? So most of them are harmless. That means most women have it, they move around with it, but there's no problem. So they often go unnoticed. Typically they can resolve on their own, but some of them, they can be stubborn, they can cause some one or two issues to you. All right, so for the types of cysts, we have things like the dermoid cyst. This one can contain, like, you are having foreign things in the ovaries. So you can have hair or skin, usually benign but can grow large. Cystadenomas develop on the ovary surface, filled with watery or mucous material. Endometriomas, they can be caused by endometriosis, filled with old blood. The polycystic ovaries, those ones are multi-small cysts. Right? So they are usually due to hormonal imbalance, like polycystic ovarian syndrome, which we have already looked at. So for a woman that have all this cyst, the symptoms you watch out for, she can be complaining that there's pelvic pain or pressure. Her stomach is getting big, abdominal fullness, her stomach feels like it's full. If she has sex, it's usually painful. Her periods is not smooth, it's irregular. Frequent urination or difficulties emptying the bladder, sudden or sharp pain, alright, and all of that. So diagnosis, just pelvic examination, ultrasound, blood test, laparoscopy. Then treatment is, since they usually resolve on their own, you can just be watching, be patient, watching. That's watchful waiting. Then sometimes hormonal birth controls, just to prevent new cysts from coming up. Pain relievers if there's pain. Surgery if the cyst is so large or is persistent. You treat it, is coming back, and all of that. So that's it for ovarian cysts.